Preventing tuberculosis, breaking the chain of infection. As you know, TB, the tuberculosis, is a preventable and curable disease, yet it continues to be a global health burden. Each year, million contact disease, that is the incidence, and many die from it, despite effective treatment and preventable strategies. Prevention is a key to stopping the spread of tuberculosis and achieving a TB free world. So, I will discuss the various strategies for TB prevention at the individual level, community level, and public health levels. So, let's understand TB transmission. How does TB spread? TB is caused by Mycobacterium tuberculosis, that is a bacteria which spread through airborne droplets. When an infected person coughs, sneezes, or talks and sings, it does not spread through handshakes, sharing foods, or touching surfaces. So it's a airborne infection which spread through air only. So who is at risk? Close contact of TB patient, that is household contact, or working together, people with weakened immune system like HIV, uncontrolled diabetes, malnutrition, smoker and alcoholics. More important is healthcare workers and those in a crowded setting. So let's start with the primary prevention. Stopping TB before it starts. So first is a BCG vaccination. Bacillus calamite guerin vaccine is the only available TB vaccine. It is given at birth. It helps prevent severe form of tuberculosis like miliary TB and TB meningitis in children, though not fully protective against pulmonary TB in adults. BCG remains crucial in high burden countries like India. New vaccine research is ongoing, including TB booster vaccines. Now, health education and awareness. Early symptom recognition. Persistent cough more than 2 weeks. Fever, weight loss, night sweat. These are the symptoms you should understand. Avoiding myths and stigma which delay diagnosis and treatment and causes advancement in the disease. Promoting regular screening in high risk group like HIV, healthcare worker. Strengthening immunity. Good nutrition. By taking a good nutrition, a strong immune system fight against TB better. Preventing comorbidity like managing HIV, diabetes, and other risk factors reduce TB susceptibility. Now the second part is the secondary prevention, stopping infection from becoming disease. First is the TB infection control in high risk group. Latent TB infection LTBI screening. Many people are infected but do not develop active disease or TB disease. So LTBI can be detected using the tuberculin skin test, that's TST, or interferon gamma release assay IGRA. Preventive therapy, isoniazid or rifampicin. They reduce the progression to active TB disease. Preventing TB in HIV patients. HIV increased TB risk by 16 to 20 times. Isoniazid preventive therapy, that is IPT, significantly lowers TB risk in HIV positive patients. Tertiary prevention. Now let's start with the tertiary prevention. Stopping TB transmission. First is a early diagnosis and complete treatment, active case finding through screening program, especially in high risk populations. Rapid diagnostics like Gene Expert, TrueNat, LPA, that is a line probe assay, detect TB and drug resistant quickly or very early. Directly observe treatment short course, that is a DOTS. Ensure treatment adherence and prevents drug resistant TB or default. Newer treatments for drug resistant tuberculosis, they are bedaquiline, delanamide, are improving cure rate. Now, infection control measures in healthcare and public spaces. Proper ventilation in hospital, clinic and homes reduce airborne transmission. Use of N95 mask by healthcare worker and TB patients. Cough etiquette and hand hygiene to limit droplet nuclei, that is a droplet nuclei spread. Isolation of infection. Patient is designated TB hospital or ward. Community and policy level prevention. It is the fourth level prevention. Now the government and WHO control program. National TB elimination program, that is NTEP India, aims to eliminate TB by 2025 through free TB diagnosis and treatment, nutritional support under Nikshay Poshan Yojana, community awareness and engagement. WHO, that is the World Health Organization, ANTB strategy, target for 2030. There should be 90% reduction in TB deaths and 80% reduction in new TB cases, that is incident rate. Addressing social determinants of tuberculosis: poverty, malnutrition, overcrowding, and poor sanitation fuels tuberculosis. Improving condition and reducing indoor air pollution like smoking, biomass fuels can significantly lower tuberculosis rates. So, in conclusion, prevention is the most effective tool against airborne disease like tuberculosis. It stops infection, reduce disease burden, and save lives. With vaccination, early diagnosis, proper treatment or adherence, and public health intervention, we can break the chain of tuberculosis transmission. Even one of us has a role to play as a doctor, healthcare worker, policymakers, and responsible citizens. Yes, we can end TB through prevention. We will succeed. Thank you.